What is adenocarcinoma of the bladder? Adenocarcinoma of the bladder is a rare form of bladder cancer that starts in glandular cells found in the bladder lining. These cells are responsible for producing mucus and other fluids. Unlike the more common urothelial carcinoma, which originates from transitional epithelial cells, adenocarcinoma arises from cells that resemble those in glandular tissues. This can happen either within the bladder or from remnants of embryonic structures like the uricus, which connects the bladder to the umbilical cord during fetal development. Adenocarcinoma can appear in several different histological patterns. One of these is the enteric pattern, which looks similar to colorectal adenocarcinoma and features glandular structures that produce mucin. Another pattern is the mucinous pattern, which has a lot of extracellular mucin with tumor cells suspended in it. There is also the signet ring cell pattern, characterized by poorly differentiated cells containing intracellular mucin. This pattern is often associated with a more aggressive form of the disease and a worse prognosis. Additionally, there are not otherwise specified and mixed patterns that show various forms of glandular growth. Rare variants, like hepatoid adenocarcinoma, mimic liver cancer cells and express specific markers. Typically, adenocarcinoma of the bladder develops in areas such as the bladder dome, trigone, or urachal remnant. Common symptoms include blood in the urine, known as hematuria, frequent or painful urination, and sometimes mucus in the urine. Because these symptoms can overlap with other bladder conditions, diagnosing adenocarcinoma requires a cystoscopy, which is a procedure that allows doctors to look inside the bladder, along with a biopsy and histological examination to identify the specific subtype of adenocarcinoma. When it comes to treatment, approaches for adenocarcinoma generally align with those used for bladder cancer, but they may differ due to the rarity and aggressive nature of this type. Treatment options can include surgery to remove the tumor or bladder, chemotherapy, radiation therapy, and sometimes targeted or immunotherapy, depending on the tumor's characteristics and stage. From the perspective of bladder health and bladder cancer, adenocarcinoma is a less common but significant subtype that necessitates specialized diagnosis and management. Early detection is crucial, as this cancer often presents at a more advanced stage and tends to have a poorer prognosis compared to more common types of bladder cancer. If you notice symptoms like blood in your urine or ongoing urinary irritation, it is important to seek medical evaluation promptly. This can help rule out bladder cancer, including adenocarcinoma, and ensure you receive the appropriate care.